Yeah, done.
There we go.
My mission for the day is accomplished.
Were you already made a co-host, Andrea? Do you know?
I was under the impression that Cornelia was going to do that for me.
Okay, but it didn't tell you that you're the co-host.
It didn't tell me, no. So not until you allowed me could I press record.
Well, first of all, I want to say thank you for being one of the co-leaders of this group. Afsena, so good to see you. Gidra, Sangeeta, Sislin, Mehar, Sally, Yasmin. What a powerful, this is such a powerful.
Hi, everyone.
What an honor and a pleasure to be here. So I'm going to just make sure that everyone is helped in the other groups to record. But Andrea, could you just start by making sure everyone has a chance to introduce themselves and maybe something about why they are joining this particular experience of the 3-year practitioner training? I don't know if you already had a chance to share with each other, but if you don't know each other, you definitely should, because this is some of the most beautiful, amazing people that I know in this one breakout room right now. So please take a moment, and I'll go and make sure everyone else has some. Okay, good.
Hi, everybody. I've met a few of you before on the European call. I've met Gedra and Afsana and Sangeeta, Cecily. Who else have I met? And I know that Mariam and Alice can't make it today, so nearly familiar with all of you. Nice to see you here in this group and being able to bond a bit better, a bit more, and get to know you a bit better. So I am Andrea, obviously, and I joined this amazing course because I've got an interest in natural healing, in holistic healing, and I just felt that there was a missing link, and this was it. As soon as I read the book, that was the light bulb moment, and it had to be done. So absolutely loving it. And yeah, I don't know what else to say about myself, except that I want to help as much as I can, because I've been honoured to be on the scholarship programme. So grateful for that. So I feel it is also my my mission to participate and help as much as possible. Yeah, so that's me in a nutshell. So please feel free to I will start with top left, as she's there. Gedra, would you like to tell us a little bit about yourself?
Oh, hello everyone. Yeah, I just following my heart. Actually, I feel like it's like magnet attracting me to on this path. I not really know what is in front of me. I mean, I know, but I never been like a doctor with no one, didn't have any how to say, with any doctors, with medicine, nothing to do. And I feel a little bit like strange in this place, but I just following my heart, and as I said, it looks for me like just attracting like magnet.
Yeah.
And
yeah, it's a calling.
I see calling, yeah, maybe this word. Yeah. So a little bit for me is difficult, because even I learning English, I learning Sanskrit words, and everything for me is very new. So, but step by step, I'm going.
Whereabouts are you, Gedra?
Sorry?
Where are you in Europe?
Now I'm in London.
You're in London, okay.
Yeah. Okay. But originally from Lithuania, but I'm in London now.
Right. Okay. Thank you, Gedra. Sangeeta, where are you? You just need to unmute yourself. I do that.
Probably come as the I've just arrived from work, so probably it's just a hangover.
Oh.
So, I live in Reading at the moment. And why did I join the course is actually I feel that I have always been interested in more natural way of healing, and I have, like, for myself, I have used different kind of allopathic medicines a lot, and I think I've experienced their side effects a lot and as well. So somehow that brought me or got me inspired to look for more natural and holistic way of healing. So that is why I think I'm here, and yeah, I think that's all.
Beautiful, beautiful. And what do you do? What's your work now?
I work as a nurse. Yeah.
Okay. I remember, you've told me that before. I had forgotten, sorry. Cecily.
Hi.
Hi. Whereabouts are you?
I'm located in London in the UK. Why did I join this course? Many reasons, to be quite honest. I think I've been tracking Dr. Naram for the last 5 years on YouTube. So that's where I really became a fan, looking at every video, sitting up in the nighttime, practicing the mamas by myself.
Amazing.
Yeah, so and then I hoped to have met him, but it wasn't meant to be. But nonetheless, I've met his wife, his family, Dr. Clint, and many others over the internet, and Dr. Smita in person. But I just have I'm trying to think, I've done so many different things in my life, but this has been one of the most consistent pathways that I've followed, and it seems the most, I've gravitated towards it. And like Deirdre said, it seemed to be somewhat magnetic. So, you know, we can say it's a call-in, but I think sometimes when you feel that the divine is inspiring you to do something, you also know that there's a lot of learning to be done. And you for me, I search for or seek out those people who are going to, whom I'm going to be able to learn from. So this has been one of the most welcoming groups, I must say, as well as inspiring groups that I have been part of. And so even if I think to myself, for example, the Sunday calls, I won't go on the Sunday calls. I find myself sat before my laptop on the Sunday call. It's quite, you know, so I don't even think I can answer your question fully. I think I don't know what's happening to me.
Did you attend the clinic with Dr. Smita when she came?
Yes, I did. I did attend the clinic and had the most amazing experience. It was as if I walked into the room. I know she was wearing white, but that wasn't the issue. And I know the window was, and the light was coming in from behind her, but that wasn't it. The whole room felt as though it was filled with an energy that just brought me to tears.
Wow.
And in fact, my sister was there with me and she started crying as well. So I looked at her and I said, can you feel what I'm feeling? And she said, yes. And she just met Dr. Smita for the first time, but she knows me that, you know, I don't cry over everything. So I had to say to Dr. Smita, I didn't intend to stand here to be introduced to you and start bawling my head off. But yeah, so I met Dr. Smita in person. I also sat with her and did many observations, and it was just the energy that was around her. It was as if the room was filled with, for those who drink wine, I'm teetotal, but I know what a full body wine is. That's what it felt like. It felt, you know, the energy in the room was just amazing.
Wow.
So yeah, sorry, it's a bit long-winded, but
no, thank you.
Yeah.
I wished I could have been up here. I'm in the north of England, so I've sort of I missed that tour. But I did go and see Dr. Meera, bless her, when she did a clinic up here a couple of weeks ago. And I know exactly what you mean. The presence of the doctor is the energy is amazing. And I was reduced to tears as well.
Oh wow! I'm glad I wasn't making this up, because I was standing there thinking, what is this? I could feel it all around me. I looked behind me at the door to say, what's going on? You know, why does the atmosphere feel so full, so almost like you could hold it, you know? Yes, it was a pretty amazing experience.
Beautiful.
Yeah.
Sally, did you manage to get to see a clinic? Excuse me, I'm being invaded by a hungry dog.
Oh, beautiful.
It's tea time.
Furry friends are always welcome.
I may have to disappear for 2 minutes.
Yeah, definitely.
Forgive me.
Very important. I did, no problem. I did get to go to Leicester and saw Dr. Smita there, which was a real blessing and super beautiful. And I got to take my husband there as well, so that was super nice. Dr. Clint, we did do our sharing another time. Would you like to move on with
Thank you, Sally, and thank you, Andrea. Thank you, everyone, for sharing. Did everyone had a chance? At least everyone knows everyone else that's here. So Sally, you know everyone else that's here.
Yeah.
Okay, good. Very good. Now, I did see in the group that Dr. Meera is planning on having another time with everyone here. So in a sense, this is a bonus. It's just an awesome extra thing in which we can meet. And I have an idea of something that I think would add value, but I also thought if someone here has their own personal case study, that's oftentimes the most powerful thing that can help. And so if anyone here has a particular healing story about when you faced some challenge, either for yourself or someone you love, and then you either had a Zoom call or you had a consultation or you met with one of the Vaidyas or you applied some of the secrets from the book or from even from one of the YouTube videos, and then you saw some result, I think that would be a really powerful thing just for you to know what's happening inside of your own group. So when I mentioned that, does anyone have a story where you're like, you know, I have this really powerful story that happened to me in the 100-day course or through my consultations or through the 28-day detox? Does anyone have a story in particular, your own case study or someone that you know and love that you'd like to share? Okay, Alsena always has like 20. It's awesome. Alsena, I want to hear what is the case study that you're thinking of right now?
Well, there is myself. Hello, everyone.
Hello.
Yes, we all know. And by the way, when Cecily came to see Dr. Smita, I was there and I walked in. Actually, I kind of took her into the room and she literally did actually say, I didn't plan to cry, but she couldn't believe. She kept looking at us going, I don't know what is happening. That was such a beautiful moment. So thank you for sharing again, Cecily. Yes, myself and my family. The reason why I have many stories is because I keep making appointments for my family members with or without any specific problem. Because some of them I am seeing that they are going downhill and I feel that they need to see a doctor. So I make an appointment with Dr. Giovanni or Dr. Meera or Dr. Smita. And for myself, I think you've all heard about my lung function. I actually took my hospital reports to Dr. Smita and Dr. Meera, where I have COPD, chronic pulmonary illness, that is. And the doctors had told me that this was a progressive disease and that, or disease, and that it would not get better. It is a progressive, it gets worse. And I had one lung function which showed the one reading for my lung volume, and then the next one was, it was actually 0.15, 0.15 higher the second time. And the doctor couldn't believe that it had improved. He actually said, there must be something wrong. We need you to have another test. They did another test the same day. And yes, it was 0.15 higher. And that happened as a result of taking the herbs and changing my diet and following everything to the letter that Dr. Smita had told me and Dr. Giovanni had told me. And I have a confession, some of you already know it. I still smoke. So I said to Dr. Smita, just imagine how much improvement I would have seen had I stopped smoking. And as a matter of fact, in the last year, I had doubled the smoking. And yes, okay. And I'm working on it. And that was one case that was very powerful for me to see that kind of improvement, even with doubled cigarette smoking. And my own mother, she's 86 years young. And I remember about a year and a half ago, she kept looking very, you know, the skin texture changed and she was tired. It was breaking my heart because I cannot see my mom as she lives in Iran. And I was very, very concerned. So I made an appointment with Dr. Giovanni to see her. Some home remedies, and in Iran, they cannot receive the herbs. I cannot send it to them. They cannot buy it. And if I send it, they just don't get to the recipient. And I can see the difference in my mom's, the way she speaks. She's very alert. She has no problem walking. She has no problem remembering. In fact, as she's a Muslim, she has read the entire Quran. She doesn't speak Arabic. She learned Arabic. She started reading it, and she's more alive than I am. You know?
Wow, that's hard to imagine for some reason.
Seriously, I mean, you know, she's eating mung soup at least once a day. She's cut down on red meat a great deal. Don't forget, at 86, they cannot really alter their food because they will be missing. Their body is used to eating certain way. But she's making so many adjustments. And the funniest thing is, whatever that I learn, I teach her. And she telephones her friends and she says, oh, you have knee pain? Put a cup full of, she was telling somebody that I had a group on WhatsApp. She was telling them, oh, your knee pain. Put a cup full of ajwain, put a cup full of ginger powder, make a little, put it in a cloth. I'm going to show you a picture. You're going to love it. And she was showing them what she'd done to heal. And she said, it works so good. It's so good. She's telling them how to do the barley water. I don't know if you can see this.
Yeah, we can see that.
She made these and she heats them with an iron. She puts iron on them. And then she uses one, then when that gets cooled, she uses the other. And she's teaching everybody. She's telling everybody to drink barley water for their kidney stone. The immunity tea, she's told everybody that she knows. As she's older, many people will call her to pay her respect. So amazing. Thank you.
Quick question. Thank you. Afsana, I have some follow-up questions. So for these particular case studies, we want to get into details more. First of all, does everyone know what Pindus weight is? Anyone not know what Pindus weight is? So
sorry?
Those little packs where you put in stuff and you heat it up and you put it on the body. In Panchakarma or in Astakarma, it's called Pindus weight. And those who are coming to India, you'll actually have an experience with not only, and if you're experiencing Panchakarma, it's a big part of it because it helps move toxins out of the joints and the muscles and everything, and slowly moves them to the center, and then you eliminate them on a certain day. But it's a very powerful feeling for a lot of different situations. And I'm glad that you're, go ahead.
Sorry, Dr. Clint, my mom was saying that I bought her just a normal ointment ages ago. She said she applies that and then she uses the pouch. Yeah. And she said that helps because it's heat. It opens up the pores so the cream gets inside, and amazing stuff. Amazing, just simple.
Yeah, yeah, this is really good. It's yeah, at some point, hopefully soon, we'll be teaching everyone how to make that, because it's not only that it's heated, but it's what is that stuff that's inside of there, and what is that doing when it's heated and put on your body is a real powerful science that these masters figured out. And I'm glad you brought that off, Sena, because it's something we don't normally talk about on Sunday calls, and it's something a little more advanced that wasn't in the first book, and we didn't talk about in the 100-day course. But you definitely, as a practitioner, you want to learn this for yourself and for people that come, and we'll go into that more as time comes. Afsana, for your own personal case study, I'm going to ask a question, and I invite everyone else to be thinking about what questions you have. So how
Yes.
could you, if someone comes to you with COPD, what would you, I just want to see a raise of hands, first of all. If someone comes with COPD, would you know what to recommend to them? Just raise your hand if you feel confident, pretty confident, you know what to do. Okay, Afsana, Andrea. Okay, good. So would this be helpful if she tells you exactly what she did? Okay, so get your notes out and get ready to take notes. And then this is how it starts. And you know, Afsana. So on your notepad, I would put Afsana. And Afsana, can you share your age with us?
Yes, I'm 62. On 21st
62.
of March, I'm going to be 63 years young.
Yeah, March baby, good. So 62
Okay.
years young. And then
So
on your
my,
sheet of-
my case study,
yeah, first of all, we want to know, describe the challenge. Like when you're thinking about the pain or the difficulty or the challenge, I want you to describe it. And everyone else, because Afsana, just thank you for allowing us to use you as use your
yes,
powerful
please use
story.
me. I love the case studies, and that was one of the things that I was going to recommend, that during the course, if we can, you know how we have a Facebook, what is it? No, the WhatsApp group for love and healing for 100 days for this. I would love to have a channel, or like a YouTube channel, or even a WhatsApp group where we don't write thank you to each other all the time or send love, but the only thing that we do is, I mean, seriously thinking about it in a, I'm sorry, I'm very like sharp when I say things. I don't mean to be sharp.
No,
But
that's fine.
rather than keep thanking each other and hearts and thanks and all that, just write. Then you don't need to write in, we don't need to write the name of the person for data protection, but the age, the challenge, what Dr. Clint is saying, and what were the recommendations, what was it that your doctor actually recommended for them, and why, if you did ask why, how, whatever, just like a mini case studies. Because I'm working on a project myself, I like to translate them into my language. I want to submit them to Dr. Clint, so maybe there is that element of it that we can all use for all the students doing this course, because we learn by observing, by hearing. I learn more by being in the clinic with Dr. Meera or Dr. Smita than reading my notes, to be honest. I'm a very doer. I'm not a reader as such. So
Beautiful.
yes,
Would
62
it be
years
okay?
old.
Would it be okay if I share with,
COPD.
yeah, just would it be okay if I share with you, if I share with everyone how Dr. Ram taught me? Would that
Yes.
be okay? Good. So what I was saying before is, with everyone, you want to have a notebook, and this is your notebook. And if you have a chance to take someone's pulse, then the first thing you write down is, what did you observe? Now you start with whatever. Maybe you observed it jumped more in this finger. Maybe you observed jumped more in this finger. Maybe you observed jumped more in this finger. So based on that, and we'll go more into that, but you just start by writing that, the person's name, their age, what you observe in their pulse, and that'll get more and more sophisticated as time goes on. But then you ask questions, very curious. And so in this space, because I'd much rather have you do it than me do it, what questions would you ask Afsana to discover? And then not writing down what you think she said, but writing down her words. Does that make sense? How does she describe the situation? So like the example I gave before, Dr. Ram's like, you have osteoporosis and arthritis. No, I don't. Okay, well, tell me what's happening. My joints are noisy. They're not listening to me. Okay, not listening. So you write down those words. So this is an example, a practice case of, I want each of you think of one question you can ask Afsana, And if it's the repeat question, no problem. But the question you can ask her, and then you be taking notes based on what she shares, how she describes things. And then the first is very important, isn't just to go straight to what was the solution, because COPD in Western medical terms is one thing, but in the ancient secrets, there's so many different layers of it, So what you want to do is be listening, and as you're observing over a lot of cases, you'll understand the subtle differences. Someone could say it's COPD, but in reality, maybe it's COPD with a pitta situation or something like that. But you don't know that at first. All you know is you're asking, tell me what are you feeling? What are you experiencing? What is the challenge? And then you listen really carefully to those words and you write that down. And then it's like learning a new language, because then you'll learn subtle differences. And then you find out, okay, how did you solve that problem? So anyone want to be kind of put on the spot just a little bit and be like interviewing Afsana? Anyone want to volunteer for that situation? Okay, Sally. Fantastic. All right, good.
Okay, so Afsana, how does the condition represent itself with you? How does it affect you?
First of all, it's not now, but I'm going to become the person that I was a year ago, just so you can get what I'm talking about.
Yeah.
You're constantly worried and you're constantly scared that your condition is going to get worse. And this causes you to breathe more shallow. So I was breathing more from my chest and not from my stomach area. So as you breathe like that, you start getting dizzier because you're getting in more oxygen. And what was happening with me was that I would have to use 2 inhalers. These are actually empty, but this one is called Ventolin. This one is called Foster. Needless to say that this is a steroid with its dangers for the body. And I found 25 different serious side effects with this alone. Serious ones. And I can share that with you if you want on, I can email the things that I found out through the 100-day training and through this course as well. So what was happening to me was that in the morning when I woke up, I was gasping for air. Some nights I would wake up like I would go like this, and I'd be with one eye closed as I just woken up. I couldn't breathe, and I had to reach out for my Ventolin just so that I would two puffs to breathe. And then otherwise I would be coughing so much, not even mucus coming up, but just coughing, dry cough, as I felt that as if somebody is squeezing my throat, like seriously tight. And then the more that happened, the more that I was gasping for air. And I would often have to just stop doing what I was doing. So in the morning, I would make sure that I get up at certain times. And I found that my body was getting hooked on these, because if I didn't use it I get up at 4. So if I didn't use it at 4 o'clock, I would seriously become very ill, like coughing and not being able to breathe. And so I started changing this habit of using them at that time. And by 5 o'clock, because 4 o'clock, 4 in the morning, I get up, I use, and then I would use it again after work, which was about 8, 9 o'clock. From 4 until 8 or 9, I would be coughing. And so there was fear, especially after COVID, as I was classed as clinically extremely vulnerable because of having COPD. It had a lot of emotional, many things that you go through. A lot of emotional insecurity about, oh my God, if I catch it, I'm definitely going to die of it. What would my mother feel? My worry was that if I die, if something happens to me, my 86-year-old mom would die. She couldn't handle the burden. She couldn't handle the pain, rather. And but after using so that was the answer. A lot of scared. You get very scared. You get out of breath. You get you feel that also when I was traveling on the train before, I would start coughing, and it was because I needed the inhaler, and everybody would be looking, and I'd be covering my face like this is before COVID. There was no face mask, but I would cover up, hide my face so they don't feel bad. But I felt very embarrassed that I'm coughing like that, you know.
Yeah.
So
And so, how did it affect you, Afsana, before you became, like when it first came? Because what you mentioned there was a lot of things of like how the diagnosis and the treatment made you feel. Like it brought a lot of the fear and made you feel kind of worried about the situation with COVID because of what they told you about the condition. But how did it first manifest?
this happened a long time ago. I've had this condition for 20 years.
Wow.
And that started by just, I would wake up coughing, and a lot of coughing, dry cough. And I kept going to many doctors, private, NHS, you name it. Even I went to acupuncture, Chinese medicine, and it wasn't diagnosed for many years. Until I really couldn't breathe. And then, funny enough, nobody did a lung function for me then. Because I guess I was, you know, I was very active. It didn't stop me being active. You know, I used to Krav Maga, if anybody is aware of what is Krav Maga. I'm a Krav Maga trainer. It's a mixed martial art.
Oh, wow.
I was teaching with this condition. So I was, you know, a small person teaching Krav Maga to very big men.
Yeah, I can imagine, totally imagine that.
So that kind of helped because I was very active physically.
Yeah.
But
and you couldn't carry on, or?
I could, I still can, and I never stopped it. I never stopped it until COVID.
I just want to pause for a little bit. First of all, say awesome. You guys are doing so good. It's so beautiful. The questions you're asking are really bringing out, and I'm saying that you're sharing it in such detail. Can everyone kind of feel it? Like that situation, the way she described it is really, it's helpful. Now, I'm just gonna give you a little powerful tip that can make it so helpful, is when they've had a chance to share, then just say, can I see if I understand you? And you repeat back in their words what they said. And then many times they'll be like, oh, actually, I missed this important thing. Or they'll say, if they say, yes, that's exactly it, fantastic. Then you can move to the next question. You know, so let's do that right now, just for the experience of it. And so it locks it in. Honestly, this one little secret, if you do this, will make all the difference in the healing journey, because you'll get more closer to the core. And also someone, even in feeling understood, the healing happens. Because so rare on this planet that anyone understands us, okay? Or anyone takes the time to understand us. And not that you understand, Sally, you may have understood perfectly, but she has to understand that you understand. And that hasn't happened yet. So I want that to happen.
I remember, Dr. Clint, you taught this in the 100-day training mentors meeting. And the other day with Elio, I noticed you kept saying this. And I was writing down your questions when you were talking. That was such a big lesson to all of us, you know, that Zoom call with Elio. Thank you.
The DT Devil Baba. Okay, Sally, back to you.
So I've said that, let me see if I understood you correctly. So
actually, first of all, ask permission. So can I see if I understand you?
Can I see?
Yeah.
I've said it. Is it okay if I check if I'm understanding you properly?
Of course.
Beautiful.
Beautiful. Okay, so I'm getting that you're kind of sharing a lot of fear and worry around the condition, and not so much for yourself even, but actually even more for what would happen to the loved ones, especially your mother.
Yes, you've totally understood
if
me.
you were not here or able to take care of them. And it
Yes.
felt that that was even more than the condition or how it affected you in your daily life.
You have totally understood me, Sally. Thank you.
Beautiful.
Not many
beautiful.
people understand this feeling, but you have picked up on that beautifully. Thank you. Now I
Beautiful.
feel that I'm very much understood.
Good. And I want to go, thank you, Sally. Anything else that anyone else heard that you heard Afsena say that you want to see if you understood it properly? So Sislin, Sangeeta, Andrea, Yasmin, Gidra, anything else that you heard in her description of the challenge that you want to see if you understood? Sislin?
Yes, she mentioned the social anxiety that she experienced when out in the public, coughing, covering her mouth, her face, and this was before COVID. And I would have asked her what the impact of that was on her. I would have dug a little bit deeper. I would like to dig a little bit deeper because I could see that that would affect who she was as the core person, who she was as a core person, because, having to hide her condition and yet not really having the doctors understand her as well at that in the initial stages. So I would have dug a little bit deeper as to the impact it was having on her socially, her self-esteem, her confidence, and how she was then coping with life in general. So there's the issue of the mum, her worry and her anxiety about how mum would cope if she wasn't around. But there's also the person, herself, the person, what she's going through, how she's coping in public, and having to hide couldn't have been an easy thing to deal with.
Yeah, you could feel that. So beautiful.
Yeah, I could feel that very powerfully.
So Sislin, are you open to some feedback or some idea, possibility?
Yes.
Have you ever been dancing? Like, have you ever had a dance partner and you're dancing on a dance floor? I don't know if this has ever happened.
Yes, yeah.
Yeah, and sometimes you lead and sometimes you follow.
Yes,
yeah. So what I'd love for us to do in this particular moment is practice the following part.
Yeah.
So instead of leading her where you think it should go or what you want to know, you just listen so closely to what she says, and then you say, "Can I see if I understand you?"
Yeah.
And all you do is you understand her, and then you see if she leads it somewhere else, because you may think that that's the important thing, but for her, maybe the most important thing is, "I felt like I was choking," or something like that. So in this particular case, it's what you're saying is valuable, Sislin, and it could be critical. And at the same time, in this moment, I just want you to practice not trying to predict where she's going to go, but listen so closely to her words and what's important to her. Does that make sense?
It makes perfect sense.
Okay, beautiful.
So sorry, just let me see if I understand you correctly, Dr. Clint. Does it mean that, often I'm going to talk about me, often when I take somebody's post and I'm trying to practice what I've learned, I do assume things. I make assumptions rather than do what you just asked Sally and Cecily to do now with regards to me. I would predict, I would make assumptions that, like Cecily said, that she would dig deeper. I would do exactly the same. So basically, we shouldn't do that. We should allow the person to take us to that.
Yeah, it's not that you should or shouldn't do anything, because love will guide you. And in this moment, I want you to practice something that's not that. And if you even get this down, man, it'll help so much, because so many times we want to lead them where we think it should go. No, don't do that right now. In this moment, I want you to build a different muscle, which is letting them lead you to what's important to them in their words, so that they feel very understood. Now, in the future, once you do this enough, then you'll take someone's pulse and Like, for instance, when I was in Saudi Arabia and, you know, the woman came with the burqa, all I could see was her eyes and everything else was black. And, you know, you could just barely peek her arms so I could take her clothes. And then I described her situation so much. Her husband was laughing almost in tears. She was laughing almost in tears. You know, she felt so understood. But that's not the first step. And that's not where we're at right now in this moment. Where we're at right now in this moment is, I don't know. And I want to learn. And I want to practice listening so well that that person feels so understood. Now, Afsena, there's two scenarios. Sislin could have followed up with a lot of questions and it could have been beautiful and you could have had a great connection. And it's not wrong. It's not, don't do that. All I'm saying is right now, I want you to practice something that most likely you haven't done to the extent that really would be transformational for people, which is let them lead. You understand so well. And in seeing if you understood, lots of times they'll lead it in a totally different way that, like with Elio, you mentioned him. I repeated back what he said and he's like, no, you didn't understand me. Okay, I didn't understand you. Please forgive me. Tell me more. And then he talked about something else. At the beginning, he was talking about money, but at the end, he was talking about his own heart situation. So in the understanding someone, I couldn't predict what was happening. And if I would have tried to lead that thing, I would have gone a way different direction. You know? So you want to listen. And in the uncovering, it allows them to discover even what is the thing maybe they didn't even realize. But, oh, that's the real thing. That's my pain, or that's my worry, or that's my fear. You may think it has to do with the heart situation, but in reality, it has to do with he's worried about who's going to take care of his cat or something like that. You know, you just want to understand, let them lead, understand, let them lead until finally say, yes, you understood. Now, you were being very kind, Afsena, in saying so quickly to Sally, you understood me correctly. But there was a lot that you said that wasn't covered. And but the cool thing was she honed in on what she thought was one of the core things. And then you're like, yeah, you understood that. Many people don't understand how important that was to me, you know, but that's so important, which was beautiful. Okay. Just raise the hands. Actually, I'm going to go to Yasmin. Is it okay if Yasmin, maybe she left the call. Oh, you raised your hand.
I'm here. Hello. Hi, Dr. Clint.
You know, I was just about to call on you, Yasmin, and then you raised your hand. That's fantastic.
Thank you.
Okay, I'll let you
Dr.
ask your
Clint,
question first.
Yeah, so I just wanted to understand what you were saying, and I just want to make sure I've understood it correctly. So I know in the 100-day training, you did say there was a session when you said that listen to understand. So our purpose at this stage is listening to understand them, and their conditions. So my question was that, so we are not summarizing what they are saying, but repeating what they are, the emotions or the conditions that one is expressing. So what I'm saying, like, for example, what Afsana shared with us. So like she felt embarrassed at times in public when she was trying to stop her cough or the anxiety that she has. So if we say, so can I just check with you that I've understood you correctly? So you feel quite anxious, you feel quite embarrassed when you are amongst other people. So are we summarizing, or are we using their own words to show them that we have understood them?
Yeah, you can do what feels most natural to you. And if you use their own words, most likely they're going to feel more understood. It's just this way. Because we think we're summarizing. In fact, I'll play this clip where Dr. Ram, we're in the German university course, and the doctors were everyone's hearing the exact same thing. And then people are trying to repeat their summary, and they were totally off. And then Dr. Ram says, oh, you didn't hear them at all. You didn't understand.
Yeah. I was going to say.
Yeah.
Sorry.
You can do this. Basically, we're playing a game. And what's the game we're playing? It's a game of how well can someone feel understood? How well do they feel understood by me? and try both ways and see what works better for you, you know? And it's an exploration. It should feel natural. At the beginning, maybe it'll feel a little unnatural, a little mechanical, no problem. It'll get better and better as you go. But it's something that if we anchor in now will make all of the difference. So much difference.
Definitely, yeah.
Otherwise, you'll be trying to treat one thing, but really the real core thing was something totally different. That, you know.
Yeah, I do understand. Yeah, that's what I was thinking, because in some trainings, people say how to summarize, but then people, when they summarize in their own words, so it's about their own perception, how they have interpreted that information. Whereas if we are saying the same things, like how they are feeling and their concerns, then repeating, then they would feel more that we have listened with understanding. Yeah. And there was another.
Yeah, go ahead. But I just want to say one thing. Sometimes people will be polite and they won't tell you that you really didn't understand them. They'll just agree if you summarize in their words, but there won't be that magical alchemy that happens in their heart. For everyone, if you've ever felt totally understood, there's healing in that alone. And we want that. We don't want the polite exchange in which you kind of understood them, but put your own perception on it, and then they agree to it. You want that. You'll see it. You'll see their body. You'll see in their eyes. You'll hear in their voice. It's almost like a relief. It's a healing relief that happens. It's a magical experience that's very powerful, and you'll know when it happens. Yeah. Yasmin, you have another question?
And in the questions like this, so how does it make you feel, or how it's affecting you as a person in your everyday, those kind of questions? So they are leading questions, aren't they? Should we be asking those kind of questions? Or
yeah, it's also possible, you know, and you'll learn more and more about which questions will actually lead you to solutions. But right now, I'm just want to practice one thing and keep it real simple. So you have to ask some question to start with. You know, tell me about what's happening for, like Sally asked it in a way I would have asked, but it was really beautiful. It was really powerful. I can't remember even how she phrased it at this moment, but it just opens up. You just open the space for them to speak, and you don't judge it. Like, for instance, with Elio, if I would have judged what he was saying, the timing of when he was saying it, you know, the content of what he was saying it wouldn't have helped. Dr. Ram says also, sometimes people are vomiting. And if someone's vomiting, you don't want to say, no, your vomit's no good. Keep that vomit inside of you. They're getting this poison out of them, you know? And you also don't want to catch their vomit and then eat it. Say, let me accept your vomit, and, you know, but you want them to get it out. So you give a space for them to share whatever is on their heart. All of a sudden they may be talking about their husband and how difficult it is with their husband. And you don't say, no. You don't want to stop their vomit and say, but let's talk about your arthritis. You know, this is a healing space in which they need to share what they need to share. And in that space, you say, oh, cool. Let me see. Can I see if I understand you correctly? And then you see if you understand, you know, this is the biggest challenge you're facing right now is with your husband, you know, and at the same time, you also have this situation with arthritis, blah, blah, blah. Yes, you understood me, you know, a normal situation normally with friends, with family, with doctors, with whatever, they'll only understand part, or they'll have some judgment, or they'll reinforce that negative scenario in which they're there. The same thing as well, some advanced training I won't go into right now is they share the challenge, but you see them as healed, you know, like you make sure they feel understood, but also you see a different possibility for them. So you're not reinforcing this sad situation in which you know, sometimes what happens when you're with friends is one person will complain about something, the other person will complain, and then you just share the misery with each other, and you just reinforce that miserable experience, you know? And then as a Siddhaveda healer, you understand them so well, they feel understood, but you're not reinforcing the dis-ease in a way. We'll have to go more into that because it's really subtle and really powerful, but hopefully that helps in some way, sharing that in this space.
Thank you.
Can I just say something? You know, in the questions that you were asking, I forgot who asked now. No, I wasn't shy being sociable at all. It didn't stop me socializing. I wasn't embarrassed I felt embarrassed when I sat on the train and I coughed, because if somebody was coughing sitting next to me, I would feel a little bit uncomfortable, not because of COVID. I mean, this is before COVID. And that is why I would literally hug my face and go to my knees to cough so that I don't give that feeling to somebody. But that was never a problem for me because I'm an extrovert and I liked being in a crowd and, you know, joking and, you know,
Yeah.
my little character.
That's interesting, Cecilin, huh? Yeah, that the clarity comes. You could say, can I see if I understand you? And then as you say, when you're on a train, it's actually making it so you're afraid of being sociable. Did I understand you? And she's like, no, actually, I love being sociable. I'm just a bit like this, you know? So it's good. You know, I wish we had so much more time to go into all of this, but it's a good thing, even if from this alone, you practice this with your people in your family, if you have children, asking them a question and saying, can I see if I understood you? You know, with your spouse, Afsana, with your mom or with your brothers or sisters or friends. Just practice this over and over and over again, this skill. Okay, Yasmin, do you have another question? I want to make sure we complete if you have any other question.
It's not on this topic, but it's on pulse reading. We have just learned, you know, just about those 3 fingers and feeling those 3 doshas. So how would we be when would we be covering more in depth how to read that pulse?
Yeah, great question. So at this point in time, we're getting the basics in place. And then once those are in place, then we can build, but we have to have that foundation there. So over the 3 years, you'll learn a concept, you'll apply it, you'll have more questions, you'll ask your mentor, and then you'll go deeper and deeper like this. So over the whole span, it'll just be happening, unfolding at the pace at which we see that it needs to happen. But that's a really good question. Okay, so now I want to complete with the case study, but let me ask you what would be most helpful for everyone. Afsana, she can summarize what solutions she happened and she can put in the chat. So that way you have them all written out and it's there. Would that be helpful to have it done that way? So Afsana, if there was any home remedy, if there was any marma, if there was any herbs, if there was any diet, if any lifestyle, if any panchakarma, if in the group chat, you could just list out, for my situation, this is exactly what I did. And then it took this long and I saw this, and then now I feel blank % better. You know,
I will do that.
The change, like what it was like before versus what it's like now as a result of taking those steps.
I will do that.
Okay,
and incidentally, I don't cough anymore like that.
Fantastic. Good. All right. So, because really we have just about like 8 minutes left. I just want to make sure there's any other Q&A time. So Sangeeta or Andrea or Giedra, anybody have any other questions? Okay, Andrea.
I would just want to ask Afsana if you could put in the chat what your dosha is as well from your pulse reading. Was that?
What do you think I am?
Vata.
I'm intoxicated with. I'm Vata Pitta. What a pity. I'm Vata Pitta.
I like that. Okay.
And so it has its own problems being very high in Vata. Which I've learned so much about my own doshas, which I can share. I will share on the group chat.
Thank you.
So Dr. Clint, can we have that? Can we have this thing that everybody will put their own whatever, like their clients? That would be helpful to everybody, because we cannot always be with the doctors.
Yeah, we'll have more and more of this, definitely. Yeah, great.
I love healing stories.
Yeah, that's so good. Andrea, you had a follow-up question?
Yeah, I do. Regarding myself, Dr. Meera, I mean, I was pretty sure that I had a Vata imbalance myself as well. But there's also a case with myself that there's a Kapha imbalance. So they're both at the opposite ends of the scale. and she recommended that we address the vata first. We're keeping the kapha in mind, but not totally ignoring it, but not addressing it totally just yet. So I just wondered, is there always a protocol where you would start with the vata working down, or would it be the symptoms that were more in that particular dosha that you would address that first?
Yeah, it's a really, really beautiful question. And sometimes with Dr. Ram, you know, people would have such a high pitta, but they'd also have cough and cold. And usually for pitta, you want to cool, but also they had cough and cold. And so sometimes there's really delicate situations, and based on, first of all, what you see in the pulse, what are the foundational things, and then also what do they want? What do they want? You know, and you listen to that, and then all those factors help guide you on which things to do first. But it's delicate certain circumstances, because you have to be you have to support. I saw next Sangeeta's hand was up, and then Sislin after that.
Namaste, Dr. Clint. I actually, this was a kind of proposal that I had made to Mariam, our group leader, and it was regarding the consultations that like as a part of the challenge activity, we have to like at least make 2 consultations. And my proposal was, is it possible, like, if the patients are agreeable, then whoever among us is able to sit on that Zoom consultation. I know there will be patients who want to have their private space and don't want to sit with so many people, but there would be patients who would also offer us to do that, and not every time all of us would be able to join, but if we have that opportunity and if we are able to join, then I think it would be I mean, we would be learning more, because we would be attending more consultations that way, rather than just like the ones that we have individually arranged. Personally, at the moment, I'm having difficulty arranging consultations. Previously, I have done consultations with Dr. Ameta, Dr. Ram, and Dr. Meera as well, and other doctors. And at this point of time, I find a little bit difficulty in finding patients as well. So that was my proposal. I don't know how like everybody thinks about it, and if that is something possible, I think that would be very helpful.
So beautiful. So you're, can I see if I understand you? you want to get the maximum amount of case studies. You're like Afsana in this way. And so your suggestion is, what if some patients don't mind if more people hear what's happening? Yeah. And if that's the case, then we can listen in on all those case studies, not just the ones that you're bringing.
Yeah.
That's the proposal. And the second thing that you're mentioning is, right now you're having difficulty finding patients. Yeah. And so you have, and in this particular case, both of those things I think are possible in some way. And so we can talk more about that. And well, first of all, did I understand you correctly?
Yes.
So there also may be the case where, because they're all recorded, as far as I know, maybe they're not all recorded, but we can find out. In some cases, if someone is interested, like you have a family member or friend, they're fine with their story being used with the other practitioners and understood. We could even ask, because all of them can be recorded. And then like Dr. Meera can send it out to everyone, say, you guys really got to listen to this one. You know, so even if you're not able to attend live, maybe also you could listen to the, you know, that interaction is a possibility. And I'll talk with Dr. Hemon about how to do that systematically, but great suggestions. Is everyone else interested in something like that? You can just raise your hand if that would be helpful. Okay.
Possibly.
Okay, go ahead.
Sangeeta, I will be your patient. I'll book me for an appointment. Okay. I mean that. I learned so much by being a patient.
Well, and I want to say that if we do our job correctly in the 3-year path practitioner training, you will have an overabundance of patients in which, you know, you'll just realize we need to get more practitioners trained because you won't be able to handle as many as are going to be coming. Like that's the difference between Siddha Veda and maybe some other situations. It's like the ultimate challenge will be how do you take care of so many people? I want to see that situation for you, Sangeeta, as well. Okay, Sislin.
I feel like my question is actually being answered through this this call. In a sense, it's about timing in a consultation situation, Dr. Clint, and I'm reflecting on Dr. Naram. You know, giving each, you know, having 100 clients to see and giving each person, you know, 3 minutes or something like that, a short space of time, or having 300 clients and only being able to allocate you know, a specific time to see each client. And in order to, my question is, I don't know if I think you're demonstrating it to us, how you validate, you know, what the client is actually experiencing or the patient is experiencing in that short space of time by showing that you listen to them, but also from what you've just demonstrated so well to us, you're repeating back to them exactly what you're checking with them to make sure that you understand exactly what it is that they're saying. But I'm looking specifically at how you do that in such a short space of time. I don't want to answer myself.
You know, Dr. Ram was a mastery level, but he didn't start that way. At the beginning, he took like 2 hours with people every week and still didn't understand them, you know. And through the ancient secrets, you know, you just get to a level where, yeah, I mean, at 3 minutes with him, you feel better, more understood than ever in your entire life, you know, and confident that he could help you. It's a couple of things you want to have happen in that magical space. And honestly, it doesn't take long when you really become good at it. It doesn't even have to take very long at all. Like you walked into the room and you felt the energy of healing. So that the healing already happened in a big way. And so at that point, it's just a couple questions and then understanding the path that you need to walk. And if you have that conviction and confidence will help you, it doesn't require more time. So, but at the beginning, main thing is just you'll feel it into it yourself, and it'll fit your personality and your style. But you know, I'm thankful that Dr. Ram had that capacity so he could help so many people, way more than if he would have taken a half hour per person. You know what I mean? And yeah, so, but at the beginning, main thing is you're not playing a game of time of how long it takes. You're playing a game of how well do they feel understood. So again, I'll say that again. It's not how well do you understand them. No, that's not the game you're playing. The game you're playing is how well do they feel understood. Yeah.
Thank you for clarifying that, because, you know, when you see your consultant or GP in this country, it's 20 minutes. You know, you have 10 to 20 minutes, you know, to say what your problem is and to you know, get a prescription and to leave. But this is, and often you feel like they haven't heard you. So I just wanted to have a clear distinction between that situation, that scenario, and what yourself and and Dr. Naram have taught so many people. Thank you for that.
Yeah, you'll start at a certain point, but then it could be, Sislin, that you'll have 100 people waiting for you. You'll be able to help each of them feel so understood within 3 to 5 minutes, and then that healing journey begins for them. You know, it could happen like this. Just be open to that possibility. You know, I see more questions, but I really need to go. And I want to say I love you. If you have more questions, you can put them in the chat. I have so many pending things, including taking care of myself and eating breakfast, you know. And so I just want to say thank you for being on this call. Hopefully something we shared today was beneficial for you, and any additional questions you can ask in the chat. You also have another session with Dr. Meera, but it's such an honor to be with each of you in this space. What a powerful, powerful group. Yasmin, Yidra, Sally, Andrea, Afsana, Sangeeta, Sislin, and then all those who are watching the recording. Mariam, thank you. I love you and I'm with you. And thank you for
Thank you for this session, Dr. Clint. Can we have some more sessions with you alone?
We'll see over time. I'm a big part of the whole experience for you, but we'll see. Yeah. You have
Thank
so much
you.
to learn
Thank
from
you.
Dr. Meera. I have so much
Thank
to
you
learn.
so much for your time. We really appreciate. Yeah.
Yeah.
Guys,
been a
can we just
privilege.
stay
Yeah.
when Dr. Clint goes? Can we just stay? I have
Yeah,
made something I want to share with you.
Super. Yeah. If you want to, you can stay in this
Yeah.
room for as long as you feel until you're complete.
2 minutes.
I have to go. I'm so sorry. I would love to stay with you, Afsana. Thank you so much, Dr.
Thank you,
Clint.
Sally.
Lots of love to everybody.
Thank you. Thank you. Thank you. Bye. Bye.
Bye, Dr. Clint. Thank you.
Bye. Thank you. Thank you, Dr. Clint. Thank you.
Guys, can I just share with you
Hi,
something?
Afsana.
Yes.
I made this questionnaire. I just want your opinion. Can I read myself?
You've made this questionnaire.
Can you see this?
Mhm.
Okay. This was, I did it. You know the book, the session 4 and session 3. You know, the bonus course.
Mhm.
The one that we had to, the first one, the one that was due 2 weeks ago, that we had to do as a challenge, find 3 clients and find their dosha.
Mhm.
So when I did that, I did this questionnaire, but I took it from the notes, you know, from our notes.
Mhm.
I realized that in all of the 3 doshas, there are certain things that are common, like digestive issue. You see it in kapha, pitta, vata. Like, where is the heart? Oh God, I forgot to highlight it. I didn't know that I could do this today, but like heart problem appears in more than one dosha. And I gave this out to some people. I had to actually go through it myself because they didn't understand and they were getting, I've put the vata sub doshas and the pitta sub doshas and the kapha sub doshas. And I just took it and I wrote as it was in the notes, like this.
Mhm.
Okay. Now, the funny thing was that when I was taking their polls, so they would circle some of them, or they would tell me and I circle or I tick. And then when I took their polls, I didn't see any vata in this. They had ticked more of pitta and kapha, but their polls was a definite high vata, just like mine, jumping like crazy. Does anybody know why this is? Any idea?
Not yet.
No? Would you like me to share this with you?
Yes, please. Yes,
That would be
please.
great. Thank you.
Yeah, that would be good. Yeah.
That's a good idea. It's a good idea, and it really demonstrates. Sorry, Afsana. It demonstrates that people don't always know what their problems are. They think they know what they are, and that's where our questioning comes in, isn't it? Because they may feel that certain symptoms are really important to them, but on the other hand, there are underlying things going on that the pulse can detect that they haven't considered. Are the causes perhaps? I don't know. It's difficult to say. I don't know nearly enough at this point, but I do know because I've questioned a lot of clients in the past for nutritional therapy, and I always give them a questionnaire in advance, and I sort of go through it before I see them and sort of tick boxes and think, yep. That seems to be the issue, and then they come to me for the consultation. And when you start questioning around the symptoms, totally different things come up that they'd forgotten to put on the questionnaire. That they've forgotten. I forgot to tell you about that. Yeah.
Thank you for that, Andrea.
So I don't know.
Thank you, because that baffled me a lot.
Yeah.
I had a question to ask Dr. Clint in case he's watching this video later or something, or maybe I can ask at another time. And that was, you know, when I was reading the book a long time ago and I was watching the videos and people talking, it was always mentioned that Dr. Naram knew the problem before, like the patient didn't need to say what's wrong with them. He could actually take a pause and say, hey, this is your blood pressure, or you have hepatitis or whatever. Now, when I was with Dr. Smita sitting in a consultation, the lady came, and I had already spoken with these people. They were from Iran. I didn't know them very well, but when they said they're coming for consultation, and as I was greeting them, I kind of just briefed them that this is about, you know, whatever. So I was just giving them an underlying information. And a lady that came in, she was, Dr. Smita took the post, and she said about her weight and that she's not finding it difficult to lose weight and that she has some inflammation. And I think the woman that was the patient, she was kind of, I don't know, I don't know why she did that, but she kept saying to Dr. Smita, is this it? This is what you have found? Is this it? What is? And when she said, yes, this is what I think and what I've picked up, she said, well, I have MS, multiple sclerosis. And then as they were leaving, she said, oh, she didn't pick up my MS. And I was trying to tell her that they don't look for disease, they look for blocks in your body, the blocks that would have caused the disease. But looking at the videos of Dr. Naram, he was able to actually name the disease.
Yeah.
You know? So, do you get what I'm trying to say?
Yeah.
How come he could say the disease?
I don't know, maybe all the doctors have a different way of doing things. I know from watching Dr. Meera, she did the pulse on both hands. She first did the right hand and then she
the left.
used the left hand as well. And she said this, not all the doctors do this, but that's what she's learned to use as a tool for herself. It works for her. So maybe there is an individuality when it comes to using the pulse reading and how they use that. I don't know. Good question to ask.
I also found that the students of Dr. Meera, as Dr. Meera teaches pulse healing, when they were taking the pulse, as they were taking, they were moving, and then putting and moving, and putting back. And I've been doing this as well as I take people's pulse for my learning. And I find that it really helps me. Which is the, like, is it really true, the feeling that I get with my fingers?
Yeah.
But I still haven't mastered what is a sticky pulse.
Interesting. I've not,
you know, because Dr.
Yeah.
Giovanni was telling me, he was teaching me one day, and he said, it depends on many factors when you feel the pulse. And one of them is not just about how it's jumping or how strong it is, that's one of them. But the other one is it sticky? Does it feel sticky to your finger?
Amazing.
It's amazing. I'm so amazed. Thank you.
Amazing. Thank you, Asana. Okay. Can I
ask you a question, Asana? Yeah, or everybody on the thing. On pulse reading, you know, when I was trying to read pulse, experimenting, there is one type of pulse which is like, it feels, I don't know, I just wanted to ask you whether you experience that. One is thin, kind of thin pulse, and one is more spread out. You know what I'm trying to say? So one is, you can say, slim kind of pulse, which is beating, say, vata, you know, increased, but it's thin. It's thin, and the other time, you know, it could be a more spread out, a more thicker You know, if you think about the measurement, so it's like one is like 1 millimeter and one is 2 millimeter, that kind of thing. Did you feel that anyone when you were trying to read pulse, or is it something that I'm thinking in my mind?
Yasmin, you know that technique that Dr. Meera was taught, to lift your fingers, one of them. So when you put the 3 fingers, just lift one by one. So the one that seems to be spreading as if it's kind of just going, you will pick up. You will pick it up. You know what I mean?
I wasn't there when she kind of covered this. When was this? At the clinic?
She didn't, no, she didn't cover it. She was, she has other students that are doing post reading, just post reading for her, with her.
Okay.
Remember that day there was a girl, Poonam, and there was Jen?
Yeah. Okay.
Jen and Poonam are her students doing post reading only. They're not doing the course. They don't want to become a healer like this way. They are,
okay.
One of them is pharmacist and whatever. They just want to be able to read the post, and they were they told me, and then I asked Dr. Meera and she explained to me. Like that.
Okay. So did you understand what I'm trying to say? You know, when I felt the pulse, so you know, sometimes it's a thin, sharp pulse, and sometimes it's a like thicker kind of pulse. Has anybody come across with that kind of thing?
I've not had enough experience yet. I've literally probably only taken 2 pulses so far. I didn't
do many, Andrea. I only did maybe 1, 2, 3, 4. So one was like a thin, you know, when you imagine a thread, so it's a thin thread and there is a thicker thread. That kind of thing I felt in one pulse, and I was thinking, does that mean anything? Does that mean anything
So
as well?
next Friday we have a meeting with Dr. Meera. Maybe she can
ask her. Yeah.
Okay. Yeah. Good.
Okay, guys, I'm really sorry, but I'm going to have to go now. So I'm going to have to stop the recording.
Okay, darling. Thank you. Thank you, Andrea.
You're very welcome. It's lovely to see you all again. Now, look, are you going to be on the other call on Friday and with Dr. Meera?
I'm hoping so.
Yes.
Yeah.
I'm hoping so.
Because, great.
So we're lucky we get 2 mental calls. That's brilliant. We have Dr. Clint in one and Dr. Meera in the other.
I think we were very lucky, guys.
I think we were really
very lucky.
Yeah. Lucky to have him. Yeah.
Absolutely. So it's fantastic to see you all, guys. And look forward to seeing you.
Love to everyone. Love you, Gedra.
Thank you.
Love you when I'm with you.
Are we staying or are we just going now? Thank you. Bye.
You're going
Bye.
now.